back when I was expecting Danielle in 1989, I was a transplant coordinator for Aurora St. Luke's Medical Center, and during between 89 and 92, a transition occurred in the program. The program was really starting to grow. It was the early days of the Symbion ventricular assist device, the early study of the HeartMate assist device, and the Jarvik was starting to be looked at as an option. And now it's called the Cardio West, but it's a similar machine. And at that point, the physicians made an executive decision to move the transplant program from their offices into Aurora St. Luke's Medical Center. And I was one of 2 nurse practitioners that worked in that clinic. And so I had worked with these people on the patient side from well, I worked with transplant patients as a staff nurse since '85. So in the early days of the program when it got restarted. And then I worked in the transplant clinic with Dr. Tector, who's in research now, and before Dr. Downey came to Aurora St. Luke's Medical Center. And I worked with these people then from '89 to '98, and in 1992 is when the birth of the Aurora St. Luke's Medical Center transplant clinic was founded. So a colleague, Diane Dressler, whose daughter now works in the works for Dr. Downey, and I, and Chris Ullenberg, the financial counselor, we were kind of the core group of the clinic.
And you're both sitting here right now. You pretty much are, you know, you're here today because of this transplant services group.
Right.
Life works in a real kind of odd way. I mean, would you ever have thought that you were going to be coming back here for your own daughter? I mean,
No.
How weird is that?
It is. It's just weird.
Yeah.
It is. And Danielle kept meeting people, and they go, I know your mom. I knew you when you were a baby. I saw you in your baby bonnet. And it's like, yes, that's true, because a lot of those experts are still working in the field here at Aurora St. Luke's.
Did that make you feel safer?
Yeah.
Yeah.
Because it seemed like, it kind of felt like a family kind of a thing, because I just felt like they wanted, I mean, every nurse and doctor does their best for every patient, but you know, it just seems like they went a little bit extra.
Yeah.
Because they've actually never used the Jarvik for an endocarditis case.